My name is Suyog Dhakras. I'm a consultant child and adolescent psychiatrist, and I work as a forensic child psychiatrist in the Hampshire and Isle of Wight Forensic CAMHS community team. Today I'm going to talk briefly about the risk of violence to others and about risk statements. If we look at youth justice statistics for 2022 2023, which were published on the 25th of Jan 2024, we'll see that the risk of violence to others as a proportion of proven offences by children and young people in England and Wales amounted to approximately 4% of all proven crimes. If you look at first-time entrants into the youth justice system, approximately a fifth had committed violence against a person as a crime. And what we also see from the statistics is that a smaller proportion of repeat offenders commit a significantly higher proportion of and more serious crimes, including violent offences. Often, as a forensic CAMHS service, we get asked by various professional colleagues to comment on the dangerousness or the high risk that a child or a young person might present to others. We find it difficult to think about risk rather than dangerousness because, as a concept, dangerousness can be construed to be dispositional, as it is either an integral part of a person's temperament or not, that it is static, that is, it's always present or not, and not subject to change. And it's dichotomous. Whilst when we talk about risk, we talk about an event that is contextual, that is, it depends on the situation and circumstances, that it's dynamic, which means that it changes, and that it lies along a continuum of probability. So the risk of a particular incident of violence to others occurring might be low risk or might increase along that continuum to become high risk and imminent. And that's a much more useful way of talking about risk to others in terms of violence, because that helps us think about what might be done to mitigate situations where the risk might be high. Whilst talking about risk of violence to others, it's also helpful to think conceptually about two different types of aggression. One is called reactive aggression, and the other is called proactive aggression. So reactive aggression usually is an angry or retaliatory response to a threat that's either real or perceived by the child or young person. This is the more common type of physical aggression that we see in children and young people. It's impulsive and usually occurs without considering the implications of the violent act. These young people are often themselves victims of physical abuse, harsh discipline, or other abusive or adverse experiences. These young people are often seen to be vigilant. They're searching the environment for cues of threat, and the extent of the aggressive act is often limited by the circumstances. Proactive aggression, on the other hand, is unprovoked, it's goal-directed. It's a part of the repertoire of behaviors that the young person might see to achieve what they want. So it's an effective way for them to achieve a goal. It's usually non-impulsive, and there usually isn't any anger or high arousal involved. The young person will often show a belief in their ability to implement violence or aggression to get what they want. These young people may well have exposure to adverse circumstances and adverse childhood experiences as part of their development, but they will very often also have exposure to role models who are aggressive and who use violence as a way of resolving any kind of conflict. They may have experienced feeling weak and powerless themselves, and the display of aggression is a way of demonstrating strength. Of course, not all young people we see can be very neatly classified into these two types of aggression, and very often there's an overlap. But it's useful to have these concepts in mind because we can then start thinking about what interventions might we provide in terms of working with these young people. So, for instance, in proactive aggression, which is controlled, which is non-impulsive, which does not usually have anger or arousal as a key component, it might not be the best option or the most useful option to be sending young people like this for anger management classes. How do we think about conceptualizing and rating the risk of violence to others? There are a number of different ways in which risk assessments can be done. A traditional and long-standing way of doing risk assessments is by a forensic expert, for want of a better term. And these would be professionals who have experience and training in forensic issues. They'll collect a significant amount of information, historical, as well as other information from a variety of different sources, and come up with a rating of the risk of violence in the future. Such risk assessments are very individual. They're very difficult to It's very difficult to demonstrate inter-rater reliability, i.e., if another forensic expert undertakes a similar assessment on the same case, it's highly likely that they might come up with a different rating. And it can be very difficult to communicate this violence or risk of violence rating in a way that leads to the creation of a risk management plan. A second a common way of assessing risk is actuarial risk assessment. And all of us are familiar with that because those of us who drive, our car insurance premiums are based on actuarial risk assessments. A key part of which is reliance on static data such as age, sex, past history of accidents, etc. This can be useful in terms of looking at risk of violence in adults, but not that useful when we are thinking about the risk of violence shown by children and young people, because by its very nature, childhood and adolescence is a period of flux. It's dynamic. Issues keep changing. Children and young people develop, mature, develop positive abilities. And so an actuarial risk assessment can actually be misleading. The most appropriate form of risk assessment that currently is used and which seems to have the most significant amount of evidence base in the literature is structured professional judgment, which is anchored in research and professional literature. It usually takes into account historic or static factors and dynamic factors such as social factors, contextual factors, and individual factors. The structured professional judgment risk assessment involves using these evidence-based risk factors into a checklist, collecting valid information from as wide a range of sources as is possible, and then using professional judgment in a multidisciplinary manner to rate each of these risk factors. And the other significant benefit of using structured professional judgment risk assessments is to be able to derive a risk management plan or mitigation plan that can be realistic, pragmatic, and can be implemented in the here and now within the resources that are available. An example of a structured professional judgment would be the SAVRI, or the Structured Assessment of Violence Risk in Young People. Having undertaken a risk assessment, it's really important to communicate what the outcome of the risk assessment is. And we in forensic CAMHS stress the importance of communication of any kind of risk in the form of a risk statement. So rather than coming up with a statement such as "this young person is dangerous," which does not tell us or give us much information about what do we then do about that dangerousness, or that this young person is high risk, which again does not tell us what do we do about that high risk. It's useful to use the concept of a risk statement. Even the most prolific offenders, even the most frequently offending young people, or young people who show a high frequency of violent acts towards others, are not violent all the time. So it's useful to think about what are the contexts and the circumstances in which that risk might increase, and what are the context, circumstances, and interventions in which that risk can be mitigated. So it's quite useful to have some key elements as part of a risk statement that can be shared with other professionals so that it makes immediate sense to them about what is it that needs to be acted on. Many of the children and young people that we work with might also move. They are likely to be in care. They might move placements, and a risk statement is a useful way of communicating issues to do with risk of certain events happening in certain circumstances when the young person moves. So the key elements of a risk statement are what is the likelihood of the violent act if no intervention is undertaken, and that could be that is generally written as either a high likelihood of a violent act happening, and so on. What is the nature of the violence towards others, and it's quite useful to give details about this. The severity, what sort of injuries could happen? Could it result in death, for instance? How imminent is it? How soon is it going to happen? And what is the frequency with which it's likely to happen? Who are the likely victims? What are the situations or contexts that might increase the risk? What are the steps that could be taken to mitigate this risk or manage or reduce this risk? A key element of any risk statement is victim safety issues. So, what plans have been put in place to help victims and ensure victim safety? And it's absolutely essential to review the risk statement as clinically appropriate and as frequently as is needed. A common kind of indication that a risk statement might need to be reviewed would be if a further risk act or a further violent act happens. Another scenario would be whether there's a significant change in the circumstances or support that the young person has, and it's going to be important to review and reevaluate the risk statement in the context of whichever risk assessment structured professional judgment tool that you're using. Further information is available on the Forensic CAMHS pages as part of the Hampshire CAMHS website.